So our little bee friend here, 25-year surgical experience. This is false information. NSAIDs are never used immediately following surgery because they cause bleeding. And then you say some other things. Well, I used toradol in every single surgery I do, and I give NSAIDs immediately after. And I have done this since I was a resident. So let's see who the literature supports, you or me. All right, so there was so much literature in this area in various fields of surgery. So this is one from my actual field. So this is from PRS, our big plastic surgery journal from 2014, and it's a meta-analysis that actually looks at this very thing. So postoperative pain control and use of toradol. So in this meta-analysis, post-op bleeding was not significantly increased with toradol compared to controls, and adverse effects were not statistically different between the groups. In fact, pain control was found to be superior with toradol. So, what they said in this paper is that everyone should be considering toradol if they would like to decrease opioid use. And like I said in my prior video, there's reasons why we want to decrease opioid use. And if you get better pain control with toradol, why would you not? So here's another study. This comes from JACS, and this is only about 2 years old. And they did another huge meta-analysis where they looked at, I think it was 150,000 different patients included in various studies, half of which were randomized controlled trials. And they looked at postoperative bleeding and NSAID use. And this covered a variety of different NSAIDs, not just toradol, but also postoperative ibuprofen. So this study looked at patients in a variety of different fields of surgery, so not just my field of plastic surgery, and they found the same thing. NSAIDs are unlikely to be the cause of postoperative bleeding complications because the literature shows essentially similar complication rates in the NSAID versus non-NSAID group. So it looks like the literature supports me and what I'm currently doing, and I will adjust what I'm doing when the literature changes and we develop new techniques for pain control. So my last video wasn't about preventing patients from having opioids that need them. It was about things that we can do to minimize your need for them, and there's many patients who don't take opioids after surgery, and that's okay. If you need opioids, you're someone who require that because of your level of pain or the type of surgery you're having, obviously we're going to give you opioids. But I don't understand why it makes people so hostile to give other things other than opioids. There's other medications we give that I know sound like they don't work, but they're really effective. Like IV Tylenol is another thing I give to all of my patients in the operating room, and it's really effective, and you can read the literature on that with post-surgical pain too. The goal is excellent pain control for patients after surgery with minimal complications, and limiting opioids does that. You also say in another comment that you can prevent or treat the opioid-induced constipation with stool softeners, and that's not true either. So in general, these complications from opioids can be really troublesome for a lot of people, and there's a lot of patients who don't want to take them. So if you need them, great, they're there for you. But there's other options too that make your pain control better.